So Cheryl, in your journey of rheumatoid arthritis, I know you've tried many treatments before, arriving at one that works for you. What was that like emotionally for you?
Yeah, it's been hard. It's a little bit like a roller coaster. That's the analogy that comes to mind, and when things are going well, it's great. And then when things are not going well, it can be really discouraging, especially when the same treatment that used to work suddenly doesn't work anymore. I think that's a really confusing and overwhelming thing to go through as a patient. This is just part of the process with RA.
So when you're having these ups and then downs, how does that affect your day-to-day activities?
Certainly, I never realized how much I used my hands until my hands started hurting. When I'm starting to have a flare-up or a period of worsening disease, every little small activity starts becoming painful.
And it's really important for you to be able to share that with your rheumatologist and your primary care provider who's aware of your disease. Is that right?
Yeah, 100%. I mean, because I know when I was first diagnosed, my doctor actually said, we don't want it to limit you in what you choose to do with your career and with your future. In order to achieve that goal, we have to be clear with them. Like, is our disease well controlled enough to do the essential components of our job?
A disease like rheumatoid arthritis is a journey, and it goes over a long period of time. What kind of things can you share with your care team to make you feel heard?
I might feel sometimes great, sometimes bad, and then everything in between. So I think when it really helped when my doctor asked me, what's a typical day? And then tell me about what's the worst day and what's the best day. And then that way she can understand then that range, and the second thing I would say is that I really like when my health providers ask me about how my disease affects my functioning in my life. Actually the first question my rheumatologist often asks is, are you doing the things that you love? And she cares about those things genuinely, and they're markers of how well I'm doing. It's often a roller coaster ride over time, and you may have some periods of maybe like a plateau where things are kind of steady and your plan works for a while, but it is normal to have to maybe pivot.
It really requires sometimes a lot of trial and error. If you're living with a rheumatic disease, then talk to your doctor and visit roomfordialogue.com to learn more.